Hey nurses, welcome back with Dany Imran with topic 7, caring for a patient with TPN. What is TPN? Total parenteral nutrition is a method of feeding that bypasses the gastrointestinal tract. Fluids are given into a vein to provide most of the nutrients the body needs. The method is used when a person cannot or should not receive feedings or fluids by mouth. We as nurses should give appropriate nursing care for patients receiving TPN. In today's topic, I'll be explaining about the nursing care for patients receiving total parenteral nutrition or TPN. It starts off with the assessment. Prior to the administration of the patient, obtain a complete health history including allergies, drug history, and possible drug interactions. Next, we have to obtain a complete physical examination of the patient. We should assess for the presence or history or nutritional deficits such as inadequate oral intake, GI disease, and increased metabolic need. Obtain the following laboratory studies such as total protein albumin levels, creatinine, blood urea nitrogen, BUN test, CBC, electrolytes, lipid profile, and serum iron levels. The next step will be planning client goals and expected outcomes. The client will exhibit improvement or stabilization of nutritional status, should be free of infection or injury related to TPN, and demonstrate an understanding of the drug's action by accurately describing drug side effects and precautions. Immediately report side effects such as symptoms of hypoglycemia or hyperglycemia, fever, chills, cough, or malaise. The next step is for interventions and the rationales. Monitor vital signs, observing for signs of infection such as elevated temperature. Bacteria may grow in high glucose and high protein solutions. Next, use strict aseptic technique with IV tubing, dressing changes, and TPN solution, and refrigerate solution until 30 minutes before using, as infusion site is at high risk for development of infection. Monitor blood glucose levels, observe for signs of hyperglycemia or hypoglycemia, and administer insulin as directed. This is because blood glucose levels may be affected if TPN is turned off, if the rate is reduced, or if excess levels of insulin are added to the solution. Always monitor for signs of fluid overload. TPN is a hypertonic solution and can create an intravascular shifting of the extracellular fluid. Monitor the patient's renal status. Intake and output ratio, daily weight, and laboratory studies such as serum creatinine and BUN are used to assess renal function. Maintain accurate infusion rate with infusion pump, make rate changes gradually, and never discontinue TPN abruptly, because abrupt discontinuation may cause hypoglycemia, and a sudden change in flow rate can cause fluctuations in blood glucose levels. For client's education and the discharge planning of the patient, firstly, instruct client to report fever, chills, soreness, or drainage of the infusion site, cough, or malaise. Instruct client that infusion site has high risk for infection development, hence sterile dressings and aseptic technique with solutions and tubing are needed. Instruct client to report any symptoms of hyperglycemia such as excessive thirst, copious urination, and insatiable hunger, or hypoglycemia. As you can see, the patient is experiencing nervousness, irritability, and dizziness. Fourth step, instruct client to report shortness of breath, heart palpitations, swelling, or decreased urine output. Instruct client to weigh self daily, monitor intake and output, report sudden increasedness in weight or decreased urine output, keep all appointments for follow-up care and laboratory testing. Lastly, instruct client about the importance of maintaining the prescribed rate of infusion, never to stop the TPN solution abruptly unless instructed by the healthcare provider. Lastly, the last step for nursing care of patients receiving TPN is the evaluation of the outcome criteria. Evaluate the effectiveness of drug therapy by confirming that client goals and expected outcomes have been met. The client demonstrates improved nutritional status. The client is free of infection or injury related to TPN. The client demonstrates an understanding of the drug's action by accurately describing drug side effects and precautions. Lastly, the client verbalizes the importance of immediately reporting side effects such as symptoms of hypoglycemia, hyperglycemia, fever, chills, cough, or malaise. So that is all for the nursing care for patients receiving TPN. I hope you learned something and thank you for watching.